Health info. Bringing you well-researched medical information. Today we will be discussing the different tests to help manage your diabetes. Since there are many tests patients need to take, we have divided the list into 3 parts. This is part 1, which will cover blood sugar and eye tests. So let's get started. Diabetes is a chronic or long-lasting health condition that affects how your body turns food into energy. The body breaks down most of the food into sugar or glucose, which is then released into your bloodstream. When your blood sugar goes up, it signals the pancreas to release insulin. Insulin acts like a key to let the blood sugar into your body's cells for use as energy. Patients with diabetes may need to have regular tests and checkups to evaluate the status of their diabetes. These tests help track progress of the current disease and screen for potential future complications such as kidney problems. Some of these tests are shared here. Blood sugar logs and HbA1c levels. The HbA1c test, or hemoglobin A1c, is a simple blood test that measures your average blood sugar levels over the past 3 months. It's one of the commonly used tests to diagnose prediabetes and diabetes, and is also the main test to help you and your healthcare team manage your diabetes. Higher A1c levels are linked to diabetes complications. It is therefore very important that patients monitor their A1c levels on a regular basis. A normal A1c level is below 5.7%, which means the person does not have diabetes. A level of 5.7% to 6.4% indicates prediabetes, and a level of 6.5% or more indicates diabetes. Within the 5.7% to 6.4% prediabetes range, the higher your A1c, the greater your risk is for developing type 2 diabetes. Now let's look at some eye exams or ophthalmology exams you may need to take regularly. Diabetic retinopathy screening. Diabetic retinopathy affects 30% of people with diabetes. Diabetic retinopathy occurs when the blood vessels inside the eye start to leak blood and fluid into the retina, causing damage and permanent vision loss. Early detection and treatment is crucial for preserving your eyesight. Screening for diabetic macular edema. Diabetic macular edema, or DME, is a complication of diabetic retinopathy, and occurs when the macula, the center of the retina, begins to swell. The macula is responsible for your central and color vision. When the macula swells, it damages the blood vessels, causing them to leak and thus resulting in vision loss. Diabetic eye exams. Diabetic eye exams are similar to regular eye exams in many ways. However, during a diabetic eye exam, your eye doctor will specifically focus on the health of your retina and integrity of the blood vessels in your eye. Some tests that the ophthalmologist will carry out include pupil dilation, fluorescein angiography, optical coherence tomography or OCT, glaucoma test, and vision test. Flu vaccination. According to American Diabetes Association, every person with diabetes needs a flu shot each year. Talk with your doctor about having a flu shot. Flu shots do not give 100% protection, but they do make it less likely for you to catch the flu for about 6 months. The best time to get your flu shot is beginning in September. The shot takes about 2 weeks to take effect. If you're sick, such as having a cold or fever, ask if you should wait until you are healthy again before having your flu shot. Finally, do not get a flu shot if you are allergic to eggs. Knowing the purpose of different tests and how they contribute towards understanding your overall health may inform you to make better lifestyle choices, improve dietary habits, and live a happy and fulfilling life. Look out for the part 2 of this series, where we will continue this conversation to discuss the kidney and neural tests patients with diabetes should regularly have. The links are also given in the description below. Keep watching our videos to learn more about diabetes. If you like our videos and want to learn more, please leave a comment below. Subscribe and share to help others.